Hello friends and welcome to my channel. Today we are going to discuss about the lower extremity fractures. In my previous video I have talked about the upper extremities. We have one more orthopedic injury that we have to talk about, and that is about the de Quervain tenosynovitis. Um, newly mother New mother holding the infant with outstretched thumb results in pain on Finkelstein's test, that is flexing the thumb across the palm and placing the wrist in ulnar deviation. We are going to treat it by giving NSAIDs and casting. Coming to lower extremity fractures, we have hip dislocation. Posterior dislocation is the most common, that is more than 90%, and it occurs via posteriorly directed force on an internally rotated flexed adducted hip, associated with risk for sciatic nerve injury and AVN. There's also chances of anterior dislocation. It can be due to obturator nerve injury. Treatment is closed reduction followed by abduction, pillow placing. Coming to hip fracture, there's increased risk for osteoporosis. It presents with a shortened and externally rotated leg. Treatment of hip fracture, we have ORIF, that is open reduction and internal fixation, hip hemiarthroplasty or total arthroplasty. Next we have the femoral fracture, that is because of direct trauma. It presents with fever, fat emboli, altered mental status, dyspnea, hypoxia, PTKA. Treatment would be intermittently nailing of the femur. Okay. Next we have the knee injuries. We have the ACL tears, PCL tears and meniscal tears. In ACL tears, it is mainly because of the hyperextension of force hyperextension or impact on an extended knee. We do positive anterior rod test and Lachman test to rule out meniscal tear from ACL tear. We do valgus test. If it is MCL injury, then there is positive valgus test. If it is LCL injury, there is positive varus test. Treatment would be of ACL injury using surgical graft from the patellar or hamstring tendons. MRI is the best diagnostic test. Coming to PCL, result of posteriorly directed force on a flexed knee, dashboard injury kind. There is positive posterior rod test. Meniscal tears result from acute twisting injury or degenerative tear in the elderly. Clicking or locking may be present. Examination shows line tenderness and positive McMurray test. Next we have the tibial stress test also. And tibial stress test is actually treated using casting or intramedullary nailing or open reduction internal fixation. It is also because of direct trauma about compartment syndrome in tibial stress fractures. Next we have the Achilles tendon rupture. Now in Achilles tendon rupture, there is sudden pop like sound, rifle shot sound actually. If Thompson test, that is when pressure is applied on the gastrocnemius, it leads to absent foot plantar flexion. Treatment would be surgery followed by long leg cast for 6 weeks. Next we have the Baker's cyst. It is caused by extrusion of synovial fluid into the gastrocnemius or semimembranosus bursa, and there is painless bulge in the popliteal space with acute calf pain. We have to take ultrasound to rule out DVT, and the surgery is performed if it is symptomatic. Okay, in the next video we'll see other topics of medicine, so keep learning and glowing and take care of yourself. Till then, bye bye.